Hello, my name is Dr. Amir Sharafkhaneh. I direct the sleep center in our hospital. Welcome to our sleep center. You may wonder how you will get your CPAP machine. After your diagnosis is completed and after the titration is completed and I make your report, we will order your CPAP machine. You will be asked to come to the sleep lab to see our sleep technologist or our nurse. Our sleep technologist will show you the device, will show you how to use it, and also will set you up with the device and the information. Sleep apnea is a very important disease. Therefore, all the guidelines emphasize that when we put the patient on CPAP, we will have them come back to see us frequently to make sure that they're using the device and the device is doing what it's supposed to do. Our sleep technologist, after showing your device, will set you up for another visit, which will happen usually between 1 to 3 months. In that visit, you need to bring your machine back to us so we can check your machine and make sure it is functioning properly. Also, we will look at your machine and find out how many hours you have used your device and if your device has helped you. After that visit, we will see you every 3 to 6 months to make sure that you are using your machine and there is no problem with your machine. In summary, we discussed the issue of sleep apnea. I explained to you what is a sleep apnea. Sleep apnea basically means stop to breathe during sleep. I explained that with that event, our blood oxygen goes down. And I also explained that the sleep apnea is associated with many medical problems, specifically heart disease and a stroke. I told you that it's very important to diagnose and treat sleep apnea in a timely manner. I explained that for diagnosis of sleep apnea, we ask the patient to come to our sleep lab and sleep for a night. In that night, we wire you up and we monitor your brain activity, your heart activity, and your breathing activity. With that study, we will find out if you have a sleep apnea and how severe is your sleep apnea. With that, we will find out what treatment options are available, and we ask you to come for second night study. In that second night study, we will put you on a special device that will keep your airway open so your brain can fall asleep without any sleep interruption or breathing interruption and without any low blood oxygen. After diagnosing your sleep apnea and finding the best pressure for your treatment on the machine, we will ask you to come into our sleep center and we will set you with the machine. You will take that machine home and you will sleep with it every night. We will ask you to come back every few months to our laboratory, and our sleep technologists and our sleep physicians will look at the device and will determine if that device was helpful for the treatment of your sleep apnea, and we'll try to troubleshoot any problems that you may have during the prior months of using it. Sleep apnea is a very important disorder. Sleep apnea is associated with many complications, and it is very, very important for you to take it seriously. Our sleep laboratory is here to help you. We can diagnose and treat your sleep apnea. With that, I appreciate your time for listening to this presentation. Goodbye.